A new health insurance planner will make it easier for Singaporeans to understand and plan for such needs. This may help with the difficult assessments and decision-making about private health insurance coverage, given its complexity. Now, Health Minister Ong Ye Kung previously said it is a top priority of his ministry to review insurance schemes and make sure they provide adequate coverage without encouraging overconsumption. Currently, there are 3 tiers of healthcare insurance, and all Singaporeans are covered under MediShield Life, the nation's basic health insurance plan. 7 in 10 people also choose to buy integrated shield plans offered by private insurers. These offer coverage for treatment at private hospitals or higher class wards at public hospitals. Some also opt for riders, which are add-ons that provide more benefits. Now, for more on the new health insurance planner, our reporter Sabrina Ng takes us through how it works.
Healthcare costs have been rising here in Singapore, and with so many different insurance plans and options out there, it can be difficult to pick one that is most essential and cost-effective. So let's take a look at the new health insurance planner to find out what are some options available. After logging in with a SingPass account, users can choose which type of medical insurance plan they have if they have private insurance. Additional details to be filled in also include monthly salaries before CPF, bonus amounts, and whether the user has any long-term care insurance. The planner will then generate several projections based on these details. Let's take, for instance, a 46-year-old individual. By age 70, he may have made cumulative savings in his Medisave of around 285,000 Singapore dollars. This first projection shows his cumulative expenses if he only has MediShield Life coverage. The second shows expenses if he also has private insurance. And the last includes private insurance, MediShield Life, and a rider. Premiums for private insurance can be paid partly by Medisave, but rider premiums must be fully paid in cash. The site will also break down these expenses into what can be paid for by Medisave and out of pocket. Next, users can also choose to compare different private insurance plans. The planner will compare them across various criteria, such as annual premium amounts, claim limits, and types of procedures that can be claimed. The tool is accessible on the CPF site.
Now, for more analysis on the topic of health insurance affordability, we speak now with Dr Phua Kai Hong, Adjunct Senior Research Fellow at the Institute of Policy Studies at NUS. Welcome, Dr Phua. It's good to see you tonight. So let's first look at the health insurance planner, right? Rolled out by CPF to help people better understand their coverage needs. How useful is this planner?
Well, I think we have to try all measures to keep the costs down. So if you look around the world, we will have to have demand side as well as supply side measures. So in the case of Singapore, it is felt that we needed the business and also the consumer education about health insurance is lacking. So we need to first go into educating people first, and so we give them a whole menu of that. But if you look at the empirical experience and the evidence around the world, this is not enough because you really require more controls on the supply side as well.
In using it, what do people or consumers need to be aware of?
Well, I think if you look at the different plans, they are aware of we are made aware of many different kinds of alternatives, of coverage. So I think, number one, you have to make sure that you do not consume unnecessary care. And people must be knowledgeable about the different plans that they are buying into, And they must also not buy all the riders. Because when 2/3 of the population has opted for this IP plan, it doesn't speak well, for our basic plan. And then when it comes to...
Why do you say that it doesn't speak well? Sorry to interject.
Yes. Well, because when it comes to using the services, about half of these people do not actually use the services and then opt for the cheaper public services. So in the first place, they should not have bought the plans in the first place. So that's my biggest qualm. So I think a good system, a good public-private system should have a balance in that most of the needs will be taken care of by the basic system. So those who want to buy the extras in the IPs, to have two-thirds of it now buying, I think it's not necessary. Because when half of them don't use it, and they'll fall back on the state system anyway.
We see that more people, especially seniors, may downgrade their health insurance plans. Is this a cause for concern, and is there a particular group that should be careful of before doing so?
Well, I think in the short term, this shouldn't have any effect because the basics, which are cost effective, will be taken care of by the public sector. So if people opt when they are short of services, when they are old and retired, and they fall back on the state system, I think that's okay. But provided the state system will respond to them. But I think in the people's perception is that they think that they're going for a lower quality of care. So I think if they do not opt for something extra, and then take on the risk of the situation when they were working and have much more generous benefits, I think that should be okay.
You know, some people, they are maintaining concurrent private coverage due to non-portability of their plans, of their company insurance plan, to be specific. They are paying substantial amount of money. Is this really necessary, Dr. Phua?
Well, this not necessary. If you really think about it now, because when it comes to claiming, they were actually, and actual usage, they will actually only use half of it, and they will opt for, because of the fear of rising healthcare costs, they will actually opt for the cheaper one, which is the public services anyway. So why do you have to subject yourself to this extra coverage, in the first place?
What would you say are the best options for them then?
Well, I wouldn't say this is the best option, because once you have got into it, then you are so used to consuming that level of care, and a lot of these totally unnecessary. So you have to look at what are the determinants of health first, and what really is really cost effective and very basic,
Okay.
And I think the system should be able to take care of it.
Are you saying that allowing portability of insurance plans would work better?
Well, I think the portability question, the issue, is good because of the changes in the job market. When people change employers, they need to have comparable benefits. So I think that has to be maintained, if necessary, by legislation, because the unions and the people who are so used to that level of care would want to require it when they change jobs. So, but we leave it to the market. The market will have to decide what will be the level of flexibility and convenience versus what is affordable.
How do you think we can make our health insurance more sustainable in the long run?
I think you probably need, like the Imperial experience say, a balanced slate of cost containment measures on both demand as well as supply. So while we are going through the motion of emphasizing the consumer education and having the cost containment in terms of co-payment schemes, the empirical evidence show that the co-payment is not enough. So initially it may work, but I think in the longer term we will have, when the costs go up, we will have to come up with new measures. And what will work is a balanced slate of both on the supply side as well as on the demand side.
Okay, Dr. Phua, we appreciate your insights. Thank you so much for coming in tonight. That was Dr. Phua Kai Hong from the Institute of Policy Studies at NUS.